Hi, my name is Joshua Lin, and I'm currently a sophomore in high school, and I'll be presenting my literature review on hyperbaric oxygen therapy versus its counterpart, low pressure hyperbaric oxygen therapy, and providing a comparative review on the efficacy of both of these treatment options when it comes to wound healing. I really want to thank Polygence for giving me this opportunity to present and giving me the stage to present my work and to showcase all that I've done this summer. But so getting on to the first point, these are the couple of my main points, my 6 main things I'm going to talk about in this presentation. And first off, I'm going to give a quick overview on hyperbaric oxygen chamber therapy, which is basically when we have the patient breathe in oxygen, basically 100% concentration of oxygen at a higher pressure compared to sea level, and the minimum is usually 1.4 atmospheric absolute. Um, we do this because when the patient's breathing high concentrations of oxygen at a higher pressure than the patient is normally residing at, this increases the amount of gas that dissolves into the bloodstream, which oxygen to allow for the oxygen to reach the body and have higher oxygenation levels in the bloodstream. And this is important because oxygen is the most one of the most important parts of wound healing because it catalyzes a lot of the key functions or key components of wound healing. And oxygen allows for the body to grow and heal, which is which in turn shows why it's one of the most important parts of wound healing. Uh, the benefits of the increased oxygen level include neovascularization, increased production of reactive oxygen species, increased rate of granulation tissue formation, and the increased production of certain genes that are all essential to wound healing. All four of these have played vital parts and vital roles when it comes to wound healing, no matter if it comes to decreasing inflammation, forming more tissue, or increasing the production of blood vessels. These are all vital when it comes to wound healing, and without these benefits that are caused by HBOT, wound healing would be very difficult and take a longer period of time. And quickly, fun fact: the 4 stages of wound healing include hemostasis, which and inflammation and proliferation and maturation. So basically, hemostasis is when the body's at peace and in a stable condition. Inflammation is when they get injured, proliferation is after injury, and maturation is after healing. So these are the 4 stages of wound healing, and these are all vital to having the wound heal quickly and effectively. So the reason we're doing this research is because HPOT is not without complications. Uh, Oftentimes, HPOT causes reversible or mild side effects during treatment, like barotrauma to the ears, myopia, but sometimes it even causes much more severe or drastic side effects like seizures or congestive heart failures. And these are all due to HPOT they're still trying to understand the protocols and parameters of HPOT because different tissue types require different dosages and different treatment session times. So all these different variables cause for HPOT to sometimes be hard to pinpoint its exact protocol for treatment. So that's why we're looking into much safer options. Even though HBOT is relatively safe, we're looking to more safe options and while still having the same therapeutic effects. This is why we came into contact with low pressure HBOT because low pressure HBOT is very new and it's up and coming and it shows promising results. But the basically difference is low pressure HBOT uses around 1.4 to 2.0 ATA versus sometimes traditional HBOT uses around 2 to 3 ATA, which is a lot higher. So the low pressure HBOT in turn is a lot safer and it doesn't have as many complications because of its low pressure. But we found through current literature and existing clinical trials that low pressure HBOT is just as beneficial for wound healing as traditional HBOT. But since it's newer, there's less literature to back it up to support this hypothesis. So we still need more literature, more clinical trials to back this up. But so far, HBOT, blood pressure HBOT, has shown very promising results for to being a very vital and viable option in the medical field. And oftentimes, you see there's a fun fact that chronic wounds are wounds that stay in the inflammatory phase because of hypoxia or low rates of angiogenesis. So basically, chronic wounds are wounds that have difficult time healing, and they stay in the second phase of wound healing, which happens after injury because it is hypoxic, which means there's not enough oxygen at the wound site, and in turn, a lot of the blood vessels aren't produced because there's no oxygen to produce the blood vessels. So the wound site can't get its vital nutrients, can't get oxygen. A lot of the key functions of wound healing are not able to function without these things. So HBOT removes this factor by bringing more oxygen to the wound site, allowing for oxygen and more blood vessels to be produced and bring key nutrients to help the wound heal quicker. So the results of these clinical trials, so one of the best results we've seen is we research diabetic foot ulcers, which is one of the more common types of chronic wounds that we encounter that are being treated with HBOT. And some of the stats are 347 million people in the world have diabetes, and 1 in 20 of these diabetic patients have diabetic foot ulcers. And 15% of these diabetic foot ulcers calls for these patients to need amputations, which is a very severe surgical intervention. And 45% of DFU patients are deceased at their 5-year checkup after they're diagnosed with DFU. But even though we see these are very severe stats and very alarming statistics, the promising result is L-HBOT was used in a clinical trial produced by Huang et al. Um, and it showed that there were drastic healing results seen just 16 hours after administering L-HBOT as treatment. So you see it's very beneficial to wound healing because of its therapeutic properties. And the complications were very mild, and there was little to none complications that were found. So you can see how effective L-HBOT is, along with its low complication rates. Couple more studies showed a doubling in complete wound healing rate in crush injuries, a 95% complete survival of skin graft, and a 35% decrease in ecchymosis 10 days post-surgery. These three come from different studies, but we can see that LHBOT was used to use as adjunctive treatment option to help increase the healing rate of these different injuries, and we see a drastic increase of healing rate when LHBOT is used, which further proves the efficacy of LHBOT has on wound healing. So the difference between LHBOT and HBOT is that LHBOT has a lower risk of complications because it's administered at lower pressure, so the body's not overwhelmed. And also the LHBOT allows for medical professionals to administer this treatment for longer sessions more frequently because the lower pressure allows for the body to take in the oxygen without getting overwhelmed, without having oxygen toxicity, which often happens with traditional HBOT because the oxygen is administered at a higher pressure, causing the rate of this oxygen to dissolve into the bloodstream to greatly increase. However, that's one of the benefits of traditional HBOT because the higher pressure causes the oxygen to dissolve quicker, allowing for even more therapeutic effects to be seen at a quicker rate and without needing as many treatment sessions. But the risk of oxygen toxicity or other complications are greatly increased with traditional HBOT with higher pressures. So there's just like a pros and cons to both. L-HBOT is safer, but requires more treatment sessions, while HBOT is much quicker, but has a higher risk of HBOT related complications. But in the end, both of these treatment options are very beneficial and have therapeutic effects that greatly benefit mood healing. And in turn, both of these should be used, but there's certain conditions or certain symptoms or certain contradictions that show itself. We should uh, factor all of these things in and make a very educated decision on which of these two variations of HBOT should be used. So for the future for HBOT, it's a very promising future, and a lot of the results have been very supportive of having of HBOT being a very viable treatment options. But more clinical trials are needed to support this claim, with bigger sample sizes and more resources to back up the study, because L-HBOT is relatively new, so the literature and clinical trials are still lacking and still limited. And one of the main points of this study is how important a standardized protocol for treatment is, because without a standardized protocol, it's often very difficult for the medical professional to pinpoint the dosage or the treatment duration for different conditions. But so more clinical trials and literature are needed to establish the standardized protocol for treatment, allowing for HBOT to be even more safe and even reducing the risk for complications furthermore. Um, and also we had to compare and contrast the existing literature and the new and upcoming literature to truly understand the facts about HPOT and how effective it can be, and understand the parameters of it to give our patients the most safe and viable treatment option that they can that we can provide. So that is my presentation. Thank you for listening, and I hope that this has been an informative presentation that further pushes the medical field to truly listen and learn more about HBOT, because HBOT is a very promising option, very viable treatment option that I think will greatly benefit a lot of people. Thank you.